Some of them do have fillers that people will be very sensitive to. So some can contain gluten. You always want to check with with your pharmacy and that particular manufacturer of the supplement, especially if you're taking a generic form. You want to see if there's gluten in it. A lot of people are sensitive to corn, rice. I don't think there's dairy in it, but the fillers make people sensitive. And then the other thing that I'll hear is, well, I started on thyroid medication and I got worse. Now, it's not necessarily the thyroid medication that made you worse. It could be what dose you're taking. So if you're taking too much T4, and that's very common, again, back to conventional medicine, they will just give you more T4, more Levo, more Synthroid, increase your dose, to where you're taking this really high dose of thyroid medication, but you're getting worse. It's common that much T4 will push up your reverse T3, the anti-thyroid hormone, and will put your body into shutdown, into survival mode. So again, it's not, could it be that particular thyroid med has fillers that your body doesn't like? Yes. It could also be that you're not on the right combination or the dose.
So I want to dive in a little more on T4 because, like you said, it only works on 2% of the population. So what is the feedback messaging that is occurring when you are taking T4, and how is the liver, part of this equation? Because if you've got that backed up liver, in which I've talked about a lot, you've got non-alcoholic fatty liver disease going through the roof in people, insulin resistance, and your body is in this fight or flight mode all the time. Explain how that T4 is going to backfire on some people.
So T4 has to convert. It's the inactive thyroid hormone. So it has two paths to choose. It can choose the path to convert to free T3, which we hope it does, because we want it to convert into the active thyroid hormone, or it can choose the path of converting to reverse T3, the anti-thyroid hormone. We don't want it to convert to reverse T3, but therein lies the problem. So you give a patient more T4, more T4, more T4. And if they have a conversion problem, which a lot of us do, here's the thing. T4 to T3 conversion is like running 10 Tough Mudders. There's a lot that can get in the way, a lot that can slow it down. So insulin resistance, a fatty liver, gut dysbiosis, low iodine, low magnesium, low vitamin D, low selenium, estrogen dominance. All of these things can interfere with T4 to T3 conversion. So you can see if you have one or more of those things going on inside your body, which many of us do, you're going to have issues converting. So the more T4 we throw in the system, the worse a person can get because of all those factors that do need addressed. We can address those factors, but I would never want to just leave someone on T4 only and say, okay, we're going to lower your insulin and fix your liver and reduce your estrogen dominance and, add in iodine, mag, vitamin, all that's important to do, but then leave them on T4. No, we want to do all of those things and adjust that dose and add in some T3 to balance them out.